Reduce your risk of viral illness like the flu or the coronavirus. Wash your hands frequently with soap and water or with an alcohol-based hand sanitizer. Cover your nose and mouth when coughing or sneezing with a tissue. Throw away, then wash hands immediately. Avoid close contact with anyone who has the cold or flu-like symptoms. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health. Get information from a respectable international or official local source. When in doubt of COVID-19 information, verify before sharing or repeating the information. Prepare for COVID-19 with an easy plan of action for yourself and your family to put into practice to avoid or reduce the spread of the illness. Be calm and continue to stay informed of the developments of COVID-19. Adjust your plans where necessary based on official advisories. Your local health authority can provide the best information on whether COVID-19 is spreading in your area. If you become seriously ill with cold or flu-like symptoms, please contact your doctor or nearest health center. For more information, contact the Ministry of Health at our toll-free number 0800 MOH Care or through our Facebook pages, the Ministry of Health Belize or the Office of the Director of Health Services. We are here to help you. A health and wellness message from your Ministry of Health. Persons at risk of becoming seriously ill from the flu or the coronavirus. People over the age of 60, persons with medical conditions they already had, such as diabetes or heart disease or conditions that has made their immune system low, such as HIV or cancers. At this time, there is no vaccine or treatment. Serious cases may need oxygen or ventilator support. Be caring and show support for your elderly loved one during this time. A health and wellness message from your Ministry of Health. Reduce your risk of viral illness like the flu or the coronavirus. Wash your hands frequently with soap and water or with an alcohol-based hand sanitizer. Cover your nose and mouth when coughing or sneezing with a tissue. Throw away, then wash hands immediately. Avoid close contact with anyone who has the cold or flu-like symptoms. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health. Get information from a respectable international or official local source. When in doubt of COVID-19 information, verify before sharing or repeating the information. Prepare for COVID-19 with an easy plan of action for yourself and your family to put into practice to avoid or reduce the spread of the illness. Be calm and continue to stay informed of the developments of COVID-19. Adjust your plans where necessary based on official advisories. Your local health authority can provide the best information on whether COVID-19 is spreading in your area. If you become seriously ill with cold or flu-like symptoms, please contact your doctor or nearest health center. For more information, contact the Ministry of Health at our toll-free number 0800 MOH Care or through our Facebook pages, the Ministry of Health Belize or the Office of the Director of Health Services. We are here to help you. A health and wellness message from your Ministry of Health. Persons at risk of becoming seriously ill from the flu or the coronavirus. People over the age of 60, persons with medical conditions they already had, such as diabetes or heart disease or conditions that has made their immune system low, such as HIV or cancers. At this time, there is no vaccine or treatment. Serious cases may need oxygen or ventilator support. Be caring and show support for your elderly loved one during this time. A health and wellness message from your Ministry of Health. Reduce your risk of viral illness like the flu or the coronavirus. Wash your hands frequently with soap and water or with an alcohol-based hand sanitizer. Cover your nose and mouth when coughing or sneezing with a tissue. Throw away, then wash hands immediately. Avoid close contact with anyone who has the cold or flu-like symptoms. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health. Get information from a respectable international or official local source. When in doubt of COVID-19 information, verify before sharing or repeating the information. Prepare for COVID-19 with an easy plan of action for yourself and your family to put into practice to avoid or reduce the spread of the illness. Be calm and continue to stay informed of the developments of COVID-19. Adjust your plans where necessary based on official advisories. Your local health authority can provide the best information on whether COVID-19 is spreading in your area. If you become seriously ill with cold or flu-like symptoms, please contact your doctor or nearest health center. For more information, contact the Ministry of Health at our toll-free number 0800 MOH Care or through our Facebook pages, the Ministry of Health Belize or the Office of the Director of Health Services. We are here to help you. A health and wellness message from your Ministry of Health. Persons at risk of becoming seriously ill.
Good afternoon, all. Well, we're going into a new week, even though it's day 2 for us. The week doesn't start on a Monday, with news quasi similar to what we had 1 week ago, because we had reported our first case on a Monday. Our third case, which is imported, is also confirmed on a Sunday. The case is of a male who has a travel history to New York. He was there for 2 weeks and arrived in country on March 20th. The male did not have any sign or symptom. He was informed upon arrival by health staff to self-isolate, and whenever he became symptomatic, to be in touch with a healthcare provider. He subsequently, 5 days later, started having flu-like symptoms and he was in touch with a healthcare provider, swabbed on March 27th, and the diagnosis, screening test and confirmatory test came up positive on yesterday. He is doing overall good. He doesn't really have any sign or symptom. He's not under any specific treatment regimen. As you know, there is no real treatment for COVID-19, but he has not warranted any specific treatment from our end. I also checked, and before we go on with this case, the other 2 cases are doing very well. Actually, the mom seems to be doing better than the index case in the sense of having no sign or symptom. And the other contacts, immediate contacts of these first 2 cases, are also asymptomatic. This third case is self-isolated. We have done our initial mapping in Belize City, and we don't seem to have any immediate family member or close contact that would have been unduly exposed, if you will. Of course, the mapping exercise now looks at other layers. We are looking at other 2 persons that may have traveled with him or were sharing some common address in New York, but that's part of the mapping exercise that's ongoing. 2 things I want to stress in terms of this particular case is we had to, for a moment last night, turn off our phone, the 0800 number, because I think calls were just overwhelming in terms of trying to identify who the person was and what the address was. And that's not routine public health surveillance. At the end of the day, it shouldn't make a difference to the general population of this country to find out the specific address or the actual name of the person. Because what the mapping exercise will do, which started from when you make a diagnosis, is you go and identify and map out who the potential contacts were, including the plane manifest, which is how he got here, who he was in contact with at the airport before he went home, and all that process is mapped. But getting into the particulars of a name and an address is really jeopardizing this potential, the case then, and any potential investigation you can have. You can also go into elements of stigma, because if that's the way we are going to be treating any case, you will then understand that anybody who is in, say, self-isolation and is developing signs or symptoms may not willingly be coming forward to voice that specific concern. So I think we need to be very careful in terms of trying to work with us as a Ministry of Health while we do the work that we are expected to be doing. The other situation that came as a result of that was there's a dashboard that's up on the COVID-19 website. What that does is, once you have a case, it's just says, for example, if it was elicited, then it is just logged on, and the way it would happen is a pin gets dropped in what the geographic area is, and it goes into the center of that area that's mapped as Belize City. So I know it was snapshot, and people are already saying, okay, it's this particular address, and then people started saying the photos, this is the house. So we had to take it down because that is not the way it happens. If you go back to the map, well, we have decided, actually, my desk made a decision to basically just not make it that public. I mean, that's an internal dashboard. We can provide you the report at the end of every day going forward, but I don't know that that mapping in that situation has proven beneficial in that regard. So those two things in terms of that particular third case. So we will be doing testing for those as we go along throughout the week. We got a further 1,000 testing kits arriving on Friday, and on Friday we had decided with the Ministry of Health team to start to scale up testing in search of further cases. As you will note, this is a third case, but they're all linked to imported cases, so we have not been able to ascertain community transmission up until now. What we decided on Friday was also that we were going to be doing testing for any healthcare worker that was ill, do random sampling of any influenza-like illness across the country, and we did some of those yesterday, and swabbing any frontline person who may have been in contact with tourists, people at the airport, even they have no signs or symptoms. And that's random checks that we are going to start to do throughout this week. Again, we have been doing that. Some of the people we swabbed yesterday were tour guides. Doesn't mean they were having signs or symptoms. We're just trying to scale up the response in that regard. One other thing in terms of testing, because people are saying test, 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 we agreed with that. But when you compare the rates, and I think that the interesting parallel we can do is Japan. When I compare the rates of testing in Japan versus what we have done in Belize, our rate on Saturday for testing was higher than what Japan is, and Japan has an ongoing increasing number of cases as reported today. Now you will say, well, that seems to not be an adequate comparison. Well, they had done 27,000 tests in 127 million population. We had done, by Saturday, 89 tests in a population of 375,000 approximately. When you look at also what other Caribbean countries are doing, Guyana, which has almost twice our population, has done less than half of the tests that we have done. And so the testing rates, when you do it per 100,000 population, is not that far off from what other countries are doing. And we still intend to increase that testing situation. Hopefully we can start running out 10 tests per week this week as we try to map out where our situation is. Again, to reiterate that there is no ongoing documented community transmission that we have been able to identify. And the key elements that continue to remain in terms of social distancing, the hand washing, and unfortunately I think I can say it's not really happening. People are still not listening to the advice we have given. If you notice, we had a quarantine measure set in place, signed last week Wednesday. It was amended on Friday. It was amended again yesterday, because simply, as much as we have tried to work along with the community, with the population, it doesn't seem that we are getting much anywhere in that regard. I mean, yesterday, while our health staff was conducting and in search of potential cases across the country, because we don't stop work really on a Sunday, we had people getting photos of people partying all over the place, making long lines to buy their bolido, and I know that's a cultural situation, but while you were doing that, we had health staff out in the sun doing mapping exercises, and I think we need to start to appreciate that. Again, because just this afternoon in meeting with the team again, the ongoing discrimination continues for health staff. Staff is still not wanting to be picked up by taxi drivers, people still not wanting to sell food. That's really not helping the situation, is making the work for our staff much more difficult. So that's what I had to say for the time being in terms of the potential case, of the case that we have and what the mapping we have done. I'll ask John to do an intervention in terms of what's happening from the public health standpoint, and then I guess we'll be answering the questions as they come up.
In terms of public health, what we are starting to do now is to look at the training for non-health individuals, because we're at the point now whereby we are enforcing that anybody coming into the country will have to go into immediate quarantine. And as such, we need to ensure that the facilities are up to scale in terms of the coordination for the use of these facilities. And so we have a number of individuals who, from different organizations, who will be participating with us in this activity. We have the Belize Red Cross, we have individuals from NEMO, as well as our community health workers. And these individuals will be looking at different non-contact processes in terms of managing these facilities. So we do know that we have the one in Corozal already up and running. The individuals in these facilities is in no way showing any signs or symptoms, and so it's not really of risk to these individuals. And what they will be looking at is basically the daily management of these things from a distance, because there's no need for direct intervention with the individuals who are in these places. We will not disclose exactly where these locations are, of course, because of the incidents we've had so far in terms of people targeting these facilities and making threats for individuals who are within these facilities. But it's to reassure the community that we do have a place for these individuals to be taken once they come into the country. In fact, we've had for a time now where we've said that the border is closed only to Belizeans, and as such, we have people who are migrating from the U.S. and they are reaching our borders and they're Belizeans, and so we need to accommodate them. But we still need to look at the potential risks that exist with these individuals and ensure that we have a mechanism to quarantine them and to monitor them over the duration. We know that in most cases we've been looking at the 14-day period, but we have extended this now based on research that we now need to extend this to 21 days. I think what is imperative to let the public know at this point in time is that anyone who goes into this facility will have the obligation to make payment, and it's $110, which includes the food. Obviously, this would be something that would have to be paid, and hopefully it can also be a deterrent for those people who are trying to come in country. And this of course is actually being enforced as part of the Quarantine Act. And as we go through this event, of course, over time you will be seeing a number of changes as we proceed, as there would be the need for different type of intervention, and this one would be one that we could definitely ensure that we have security for our population. So that is a significant new activity that we will be doing over the next couple of weeks, and hopefully we can have a better grip of what we're doing currently in terms of managing those people who still are coming across our borders and entering Belize.
I was gonna grab the mic, but you're not sharing mics anymore, right? Okay. It says here, if the person has finished quarantine, how to be sure that the person is COVID-free? Will they have to call to get tested? Yeah, well, everybody who is under quarantine should really be in direct contact with his healthcare provider, the closest healthcare provider you have. What can be done, and we will be doing random sampling, is depending where you are coming from. If you did not develop any sign or symptom, your risk assessment will be done, and you may be swabbed. I can tell you we have swabbed people who, for example, came from Switzerland, and even though they were asymptomatic, swabbed before the day 14 was up, and it doesn't mean that coming negative your quarantine had ended. So that has happened. So depending on where you are coming from, your risk assessment will be done, and then determine whether you need to get tested or not. Dialysis patients who do dialysis at Carthusian and are from our district, will state of emergency affect them? I don't know that the state of emergency would affect your access to healthcare services. Healthcare services remain open. It's an essential service that cannot be deterred, and I guess a mechanism has to be in place as to how you are able to access that healthcare service. Can you at least open our windows and doors because it gets real hot inside, or do we completely lock up ourselves because of neighbors that might have it eventually? I mean, again, if you're maintaining that 3 to 6 feet distance, you should be good enough. I know that there's been discussions about it being aerosolized, it remaining in the air. That it has been shown, but it would be really in an environment that, like an intensive care unit or hospital settings, where you are more likely to have much more exposure simply because of the amount of droplets or other mechanisms that you have for transmission. So that would be in that regard.
Yeah, that I want to add to that, because in terms of looking at public health intervention, especially in years gone by when we had TB, it has been recommended that you have free flow of air circulation in the room that people live in. So this is something that can be similar to that, and we need to ensure that we could have the air flowing if we're in confined environments. Will there be a sanction for people who don't respect the quarantine order? And of course, this has been said every moment we have the opportunity to do so, and we are very serious in terms of this. And we are seeing that the police is actually looking at the enforcement seriously. And as we proceed and we find out that there's a need for intervention, for this type of intervention, we will be doing it. In fact, one of the concerns that we have is that Belize is not well accustomed to taking commands as good as many other countries, and as such, sometimes what you do need to do is something that you don't really want to do, but in terms of ensuring that we can curb the situation or ensure that people follow order, then we would then have to enforce the quarantine order. Is kind of a bit harsh at sometimes, but this is what we do need to do with the public, for those who don't want to comply. We want to make a special call or plea to those people who are vending at the fish market, or people who are purchasing fish at the food market, at the fish market. It has been reported to us a number of times already that people are crowding. We need to ensure that as much as possible we maintain that social distance, 3 to 6 feet between individuals, so that we can prevent the spread of COVID. I know everybody want to get their fish supply, but believe me, we do have enough space that we can do that. Most of these places are open, and you have enough space that it can be put into action.
Yeah, I think you said not accustomed. I don't, people might not like me saying it, but I don't think we are a disciplined society. And that can be an essential deterrent in terms of having any successful outcome in this regard, because there's only so much we as a health system is going to be able to do. There's only so much the government might be able to do. At the end of the day, it's going to be contingent on personal decisions we take, personal hygienic measures, and if you go back also to what other countries are doing, you see very disciplined societies. You have some European Nordic countries, for example, who have not really banned anything. They have gone on as life is normal, but they are just ensuring that they have a disciplined society. When they say you have to stay away 6 feet and only 10 people in the store, that kind of thing, some societies are able to be respectful of that and ensuring that all the due process is followed. People who are ill stay home. I mean, that's and unfortunately we have had to scale up our recommendations in terms of quarantine simply because it doesn't seem to work otherwise.
Yes, and I want to do agree with that. And what we do, we must make note to the public that what we do is only 20%. The other 80% comes from the public, and so we need as much cooperation as possible from the public in terms of maintaining these recommendations.
Yeah, well, we go back to the questions here. It says, will there be a sanction for people who don't respect the quarantine order? Well, the quarantine order has specific sanctions that can be enacted. One is a monetary fine, and the other is imprisonment, or both, a mixture of both, as it is. And in the people who are now going to go under mandatory quarantine, we had to develop a little leaflet with the information and let people sign because that's now enforceable by law. And again, I know we are getting specific requests from people saying, oh, but I will be disciplined enough to be able to do it at home. Unfortunately, once you drop the curtain, as you will, it applies to everybody, because we have had that story come to us for the last 2 months, and it's really not necessarily working all the time. I know some people can be very disciplined. I found out somebody who drove their family from Chetumal and said no stops along the way, and put them in a house, and that's where they are locked up for the next 14 days. I mean, they're fed almost through a fence, if you will. But I mean, that's the level of discipline that we perhaps would want everybody to have. For people that are in self-quarantine, how much time do they stay on the self-quarantine? For now, we say 14 days. We are reviewing the data. It could very well be expanded to 21 days officially now, because we're following the data as it's coming along. Even in terms of the swabbing that we're going to be doing with people who have been in close contacts. I had said last week that we're doing 2 swabs, and both have to be negative. So we're going to go back and review at exactly which day that it is that it's going to be done. I employ a caretaker to help me with my handicapped mother. Will she be able to come to work? I guess it depends on how far you live from your environment. I mean, that's I assume that the state of emergency situation will be explained in further detail tomorrow, in terms of what it is and how we are going to be able to ensure that the essential services are taken care of. How will a person be considered as all clear from COVID-19? And will the person be allowed to step out of the quarantine area, or will the ministry do more tests to affirm the test is safe to go out? It's both. I don't think you'll be able to get a clear sign from us until we are sure whether that includes a review of your history, signs or symptoms, testing for COVID-19. It is the ministry file that will determine whether you are allowed to come out of the quarantine area or not, or out of your quarantine period or not. I don't see any more questions here. I don't know if there's any more, but I think I also want to go back. I want to go back to the note in terms of masks, because I'm seeing data start to come up of the potential benefit of wearing masks. We had said, and we had been saying, that mostly the recommendation is for people who are sick. And even though there's new suggested evidence that says it may benefit the general population if everybody uses it when they're outside in the setting to prevent further transmission. I think the key take-home message for us in Belize would be analyze how the mask is being used at that level, how frequently, for example, they are changing the masks, and what kind of environments they are using it. Because for the Belize context, it might not necessarily be the best situation still, particularly when I see people wearing a mask for 8-9 hours, the same mask. I mean, it was blue, and by the end of the day it's brown. I don't know that there's a potential benefit in there. Or when people are constantly touching the mask, I mean, I know that traditionally the Asian societies have been using masks routinely, and this is not as a result of COVID-19. So these are societies that perhaps are more disciplined, have learned how to use a mask, use it as a routine part of their daily life, so they might have more benefit in using it than we in Belize. So we are reviewing the data. We are not still making a blanket recommendation in that regard. And if that were the case, we then have to start finding a mechanism for educating our population in how to wear a mask properly. Of course, if we have a state of emergency, then things start to change in that regard. It says, will medical personnel at Carl Huchner and other GOB clinics be provided with basic PPE such as masks, eyewear, gloves, or only selected few? PPEs have been distributed to all facilities across the country. As a matter of fact, I have my notes here in terms of how many PPEs have been delivered. We have gotten delivery of about 4,500 PPEs that have been delivered and to the central warehouse, and are scheduled, and the distribution process has started. And I have here on my notes 7,000 PPEs pending to arrive. A total of 264,000 nitrile examination gloves have been delivered. Blood pressure apparatus for use in specific COVID-19 care of patients. Thermometers that I had mentioned before. Face shields, safety goggles, those have been delivered to us. Ventilators, the 6 are arriving later on today, and we had a total of 24 ventilators more, I believe, being processed for arrival in country as part of the COVID-19 response. The other question here, you said that San Pedro patient 0 had 34 contacts. How many have been tested? Second, how many contacts has patient 3 had? Yeah, we had said 34. Out of those, 7 were close contacts. They were all screened. They were all negative. But before they are able to be considered negative, they will have to be screened again. The others were not direct contacts, and that's the reason why they were not tested. But again, as we opening our screening opportunities, maybe those will be taken at random to conduct testing on them. Can cyclists continue to ride their bikes if they do it alone? I guess that will be further detailed tomorrow. I know in some countries outside of Belize what they have done with people, if they are walking, running, or bicycling, they are only allowed a certain perimeter outside of your home. Right, so some people have it, I think, up to 5 kilometers. I think that will be further discussed tomorrow in terms of how far you're able to go away from your home in a, you might allege it's an essential activity, but I guess that's to be determined. Are you allowed to go out and sell your food? Again, that might be determined further tomorrow, because I guess it has to be how far away from home you're going to be allowed to go out and sell your food. Since we're in the early stages of COVID-19, and that's a very, I know that's not the question, but I think it's very, very important to say that yes, we're in the early stages, and you will hear this terminology of flattening your curve. We don't have a curve yet in Belize to flatten. So we are talking about a potential long run here in terms of it could be months. I mean, going back to data neighboring countries, I don't know what the recent data is for the US. But I know Mexico keeps saying we are not going to flatten any curve until November of this year. And that's, you notice how they have not really locked down. They have really, all they are trying to do is manage their curve. Manage their curve. We don't have a curve yet, right? We don't have a curve yet. We need to say that. We need to be mindful of that. Is it safe to say that it's looking like in-school classes will not resume by early May, given the state of emergency will lead up to 30 days in April? Many things can change between now and then. If we determine community transmission, then that lockdown may just continue. The common question, and I asked the team, and I don't know that anybody had an answer, is, okay, for example, when will life go back to being normal in our neighboring state of Chetumal, Quintana Roo, just so that you can get a grasp of where we are, because we don't live in a bubble. Or in Melchor, who has just Guatemala extended their curfew for 14 more days. And it could very well be that Chetumal doesn't start to have a curve maybe till when June, July, August, so when they start seeing more and more cases. So how does that factor in to our daily routines in terms of, okay, when will you be able to go again? There's many unknowns. It could very well be months before that goes being normal. Even in the US, I mean, if you're talking about their numbers now starting to decrease maybe till June, July, August. So when do flights start to bring in tourists into Belize? We don't know. I mean, this is we're talking about months, even if the airport is open. Those kinds of scenarios are scenarios that are changing with dynamics every single day.
And Doc, I do think that when we have this conversation about going back to what is normal, in fact, the conversation globally has been that normal will be different now. So we're not sure exactly what will be the trend in the next couple months to come. What we do know that will have some impact as it relates to the whole aspect in terms of quarantining and people being clustered for a period of time. And I think what has not really been much discussion there is the issue of mental health. And I think this morning we start engaging the public in terms of the discussion about all the public health impacts that it will have on our country. And of course, you know, when you start isolating people, the behavior start to change, and there can actually be psychological impact as it's related to individuals. And so the new shift would then be, when we're clearing out of COVID-19, would be how do we address those situations in the future to come, because some people it might impact more severely, particularly children, because you know children are people who like to be very social, to be out, and the changes in terms of the way we operate as a family now has changed significantly.
Says, how does the situation now affect workers and staff of Mopan Clinic in Benque? I don't know that this changes anything. You are an essential staff. Life will at the Mopan Clinic should continue on as normal. Your services, I don't think, are being deterred or deferred anywhere else at this point in time.
Yes, and those people have to remember that they are essential staff
services
as well.
I mean, we are the last soldier standing.
So they have to report to work.
Will restaurants and food shops still be allowed to operate using takeout services? Again, I think these are questions that, in terms of outlining what a state of emergency is going to be outlined further. Can individuals stranded and progressively return to their homes on the mainland and quarantine self-isolate there? That's also a tricky question, because what guarantee do we have that you're going to be able to quarantine and self-isolate when you reach mainland? We are already following a vast amount of people. That makes it difficult for health staff to be able to monitor. So I don't know that I have a straight answer for that. Patients indicated that she went into immediate self-isolation, but that turned out to be untrue. Have you verified the movements of patient number 3 on how early he went into isolation? As I said, that our initial mapping has happened, and it seems he did go into self-isolation and had only one movement out of his house to drive to be swabbed, and then came back to his where he's residing. That's what we have from him. So again, the mapping exercise entails going to check out his contacts and verifying what he has actually said to you, to find out if that is in point of fact true. Is it okay to go walk by the sea for exercise purposes? I think we have addressed that before. Because if everybody is quarantined at home, I think we already have an obesity problem. We're going to have a further obesity and psychological problem.
Providing it's not a big group.
Yeah, you walk alone, I guess that's what they're assuming. Those screen and found negative, do they self-isolate until the next test? Yeah, that's what is being recommended, yeah. Visitors still permitted into KHMH and other hospitals. There's been a note that's been going on for 2 or 3 weeks. Again, this is part of not being a disciplined society, because visiting hours are very strict and visiting amount of persons is very strict. Very few people abide to that. People still go to hospitals in groups. People still go to hospitals taking children. People who are ill still go visit other sick persons in the hospital. Those things are not supposed to happen. So now that we are seeking to enforce those issues, which should have been there from the beginning, we're having a little bit of resistance to that. But ideally, there's set hours that you can go and visit. Ideally, it should be the same person who has gone to visit that goes and does the visit and it should be one person only. No children allowed. I think that's being enforced strictly now. They can possibly be putting healthcare workers and those risk sick at risk of catching the virus, yeah. Visitors can be symptom-free and still be carriers, correct? Yeah, but also there's a flip side to that, and that's why we tell people don't assume that the hospital is a social area. I mean, anybody visiting should also not be in a condition where they are ill or immunocompromised, because when you walk into a hospital, you're walking into an environment that is very rich in bacteria, viruses. So not only you're taking, you can bring something much more deadly out of a hospital, which is the same reason why we encourage healthcare workers. I mean, I like to, and I keep saying this, colleagues might not like me saying it, but healthcare workers are not supposed to be walking on the street with scrubs. Healthcare workers are not supposed to be walking on the street into banks, markets, on public transportation with their lab coats. People like to wear stethoscopes in public. Those are petri dishes for all these elements. So I know we are talking about PPEs inside a hospital setting, but we have a due responsibility to protect the people outside. We cannot be taking all these things to the general population or to our families. I mean, we had a note. Well, John, maybe you should. Well, I will say. John doesn't want to say it. I will say this. You say it
I
then.
can say it. Yes, because this is a general practice we find all throughout the country. In fact, I do commute on a daily basis to Belize City, and in fact, what happened that I came off the bus and then I saw one of our health worker, a nurse in particular, go into the bathroom at the bus terminal. Now I was appalled because she was in scrubs and she was in a jacket, and this is the same jacket I'm sure she will be using to tend to the patients, and of course, it's not only now taking something out of the hospital, but taking something that was not there from this bathroom, and it's a public bathroom. So we have to be very careful in terms of how we visit locations and what we're wearing.
It says, in regards with COVID-19, are there any further health risks to those who are allergic to penicillin? No, I mean, the allergy to penicillin is specific to that antibiotic. Maybe has a cross-sectional reaction to other antibiotics that are similar to penicillin but not related to COVID. How about clinic days for babies to be up to date with their shot? I know that last week we sent out a memo to all MCH clinics across the country. So I suggest that you touch base with your healthcare provider, because where possible, mobile clinics will still happen, and I think we are rolling out what will happen with vaccine coverage and how this would routinely done at all villages. So I suggest you touch base with your local clinic to make a determination in that regard. Is consideration being given to people's spiritual and mental health in this state of emergency? People are fearful, anxious, depressed. Yeah, that's why even in terms of outlining what a state of emergency is, we need to be able to ensure that people have the basic elements that you need in terms of your day-to-day lives. Access to water, access to food, to your medication, access to healthcare, and it's how you outline that. The spiritual aspect, I think, is a more tricky situation because everybody is spiritual in a different kind of way. I know some people are starting to be depressed because they can no longer go to a place of worship, and they are doing things virtually, and you know, I am, as a clinician, will tell you that I believe in the touch of the patient and not doing things virtually. I mean, but so somehow, as you have said, it's a new norm. Maybe we have been doing things all wrong now, or listen, our lives, I keep saying it, and I'm not being pessimistic, but life will not be the same, not for 2020, and I'm not so sure how for 2021, because again, there could be something deadlier on the horizon.
Yeah. But I also think that this is a time of reflection as well, looking at the religious component of it, whereby people can be in touch greater with God, and God is all over the place. It's not only in church, but you can actually be with God every time. And in terms of moment of silence, that's where you have greater connection to God. So I think it's an opportunity we have, and we should embrace that we can make greater connection with God, because, you know, sometimes it's only in trials and tribulations that we look forward to make certain requests. But you know, it is a positive means for us in terms of making that connection.
Yeah, I don't see any questions, but we intend to continue to provide further updates throughout the week. State of emergency or not, healthcare workers will need to still continue to report to work. I think throughout the week we'll be addressing issues in terms of nutrition, mental health, which, as you have said, is an important component. And I know there's a team that will start looking at training frontline workers, because this is people who are at home, that are getting depressed, but the frontline workers as well, because there's levels of anxiety, fear of the unknown as well. I know people are saying PPEs, but even behind a PPE, there's elements that healthcare workers will have to deal with, in terms of even how you deal with your family, work, and all that situation. So that, I believe we will be participating in some talk shows to talk about smoking and the relation to COVID-19, your overall health and COVID-19. We hope to do on one of the TV shows in a more detailed fashion what flattening the curve. And I know there's lots of people that have thrown out numbers. We are not that's not our forte, but so what we do, we rely on people who are able to do mapping exercises for us. We have two different exercises that have been done. One was that we are reviewing from the Imperial College of London. And again, this is validated data based on science and understanding that things change. So we'll be looking at that throughout talk shows during the week to see what it means to flatten a curve, particularly when you don't have one. Understand, it's not that we want more cases, I think ideally you would want no case to be here, but you also have to understand that cases are going to be there. COVID-19 is not going to go away then. So if we don't have the cases right now, and everybody has their cases, but then, things will start to go back to a normal kind of state elsewhere as we go along. So maybe next year in March we're still talking about COVID-19 because it hasn't gone away. Yes. Maybe that's when our curve starts to go up. So that's the reason why we need to brace ourselves for whatever. I think we have had opportunity as a health system and as a people, because we have been saying the same message for more than 2 months, to prepare. What is our personal plan for COVID-19? If I become infected, if my family becomes infected, if my community becomes infected, what am I going to change? So I think even with the index case, people were concerned in Belize City. But at the end of the day, have we sat down to think, okay, it's here, it's closer to home, what am I going to do different to ensure that I don't become infected? I think that's the kind of internal, maybe it's, as you said, the spiritual moment is sit down, think, digest, and ensure that we are not carrying on this epidemic.
Yes.
I don't know if
yes, we have come to the end of this show for today, and we'd like to thank you for your questions. Remember to practice social distance, regularly washing your hands, which is very, very important in all that we do. Cover sneeze in your elbows and your sleeves, and stay home if you have flu-like symptoms. This is critical because it is normally an indication of when people are ill, and it can be possibly COVID-19. We want to remind you that for further information or guidance on COVID-19, to please contact us on our hotline, which is 0800 664 2273, and visit our website www.covid19belize for up-to-date information, and also to view this video again. So we thank you, and we say a blessed evening.